Welcome, everyone. Welcome once again to In Touch. Once again, Dr. John Nowicki is with us. Nowicki Chiropractic and Wellness. How are you?
I'm doing awesome, man. We just saw each
Is
other
the
the other
room
day.
still full of all that food?
Oh my gosh, it is through Thursday of this week, and then
People did good.
we pack it all up and deliver it to
Yeah.
the food pantries on next week, like Monday or Tuesday.
Sure.
And I just want to give a big shout out to all my patients that have contributed and will between now and Thursday night. We have what looks to be another equal or record amount of money collected. Again, our new patient exams for the last 3 months are the charges for them will be donated to the food pantry so they can buy perishable food items, and we have a whole pile of non-perishable food items that patients brought in as part of our Patient Appreciation Day. So this is a quarterly project that we do. This quarterly, the charity is the food pantries, and again, our patients just always come through big time with it.
Oh, yeah.
So,
Definitely.
so we got hunting season coming up. I hope everybody's got their stand all prepped. Michigan starts.
Sure they do.
Michigan starts in a week. We're here recording on
Yeah.
somebody's lucky day for the presidential campaign. It's his election day, and we're also approaching. Today feels like it finally for the first time. Winter. It's a little chillier out there, a little
It
windy,
is.
a little
Yeah.
gloomy. It's like, winter's coming, right? Well, slick roads, we all know how we drive at the beginning of winter, a little bit like it's still summer, but it's slippery out. So we call it car crash season. Right?
Okay.
They're not car accidents, it's a car crash. And if you ever want to Google, car crash, dummy reenactments on YouTube, you'll see the forces involved. There's nothing trivial. In fact, even a minor car crash with minimal damage to the car can damage the occupants. And that actually Yale University came out with a study that showed anything over 8.2 miles an hour
Right.
can cause damage to the ligaments of the spine. Okay, now think about that. Ligaments are the straps that hold your spinal bones together. Okay, we all are aware of ligament injuries to the knee, like an ACL tear, like Jordy Nelson went through with the Packers last year.
Yeah.
There's nothing trivial about ligament sprain strains. Jordy Nelson's career may be done. He isn't playing like he used to. Okay, will his contract be renewed? Maybe, maybe not. All right. Well, maybe none of the Packers are playing like they used to this year.
Well, see, it depends on who you want to blame here.
Exactly, right? But, there's only one that I've ever seen post-surgery that did better, and that was Peterson from the Vikings.
That's true.
He...
Sure, it would have to be.
Yeah, he did better post-surgery, but Jordy really hasn't, and not many people do. All right.
Doesn't take much to cause the damage, does it?
Sadly, no. 8.2 miles an hour or faster can cause damage, ligament damage. And again, ligaments are very slow-healing tissue, and 50% of the people that get in a car crash will remember that crash for the rest of their life. In other words, they're going to wake up sore, stiff, aching, paining. Their quality of life has been decreased. They're not lifting their grandchildren. They're not dragging the big bucks out of the woods. They're too sore to sit in the tree stand. Okay, understand this. The number one cause of disability in this country is low back pain. Number 3 cause is neck pain. And the absolute number one cause of both of those is ligament damage. Okay, so I'm a ligament damage expert. That's what I've devoted my whole career for. All right. So when you come into me, we do specialized testing to determine where your ligaments are damaged. We do motion x-rays that show where the bones are moving too much. Where they're moving too much, you've had ligament damage. Just like when you blow an ACL, they do a test called Latchman's test, and they pull your lower leg back and forth, and if it jogs back and forth too much, they know your ACL is blown. Well, we can't do that with the neck. All right, what we can do, though, is take these x-rays and get what's done called CRMA. It's computerized radiographic mensuration analysis. And we actually send ours out to a medical radiologist that's been specially trained to analyze these. All right, and what they do is they look at the motion of the vertebra. There should be a little bit of forward and backwards translation when you bend and move your neck, and a rotational component as well. And there are standards that will tell us if you move more than certain amount of degrees and so many millimeters, that you fit into guidelines for care. So not only do we go by AMA standards for documenting these, and they require it if you're a ligament injury specialist to treat and document before you treat where the damage is. Makes sense, right? If you're going to treat a heart issue, okay, and it's clogging, you don't want to just randomly go in and treat any artery. If it's the widowmaker that's clogged, you better go in and treat that artery. Okay?
Sure.
So my job is to find the exact bones that have the straps torn and then treat those areas for the best rehabilitation possible so that you're not part of that 50% that remembers and hurts for the rest of your life following a car crash.
Yeah.
I mean, let's be honest. You go through a car crash and you can bend the frame of your car, the unibody, the steel. Okay? If you put enough force into it to bend steel, do you think maybe kind of possibly that could have damaged the ligaments in your neck? And if so, that's why you're still hurting days, weeks, months, years later?
Sure.
Yeah, it makes sense, right?
Exactly.
So you got to get them documented so that we can treat them properly. It's pure and simple. Now, we send out for the radiographic interpretation to tell us where those torn ligaments are. We also do something in-house called surface EMG, dynamic surface EMG. So, for instance, with the low back, as you bend forward, your muscles do a certain amount of work, and that shows up on the EMG readings. We stick pads to your back, and just like for a heart scan, but this is the muscles of the back we're testing. When you get to the end point of bending forward, your weight of your upper body should hang on the ligaments, and the muscles should relax in the EMG, and rapidly. If they don't relax, if they stay hyperactive, okay, that means you've got ligaments that are damaged and you can't hang on them. You're hanging on the muscles and making them work harder than they should.
Okay.
That's a fingerprint of pain and ligament damage, muscle bracing, okay? And with the computerized technology that we have, it objectifies it. So we can objectify the ligament injury and the resulting muscle bracing afterwards, okay, that is correlated with pain. So when somebody says it's all in your head, that may be true. That's the only place we can sense pain. But the cause of the pain is not in your head. When we objectify this, we know where the cause of the pain is. And that's what's cool, because when you get in an accident, there's real-world considerations out there. You got financial problems, you got loss of work, loss of enjoyment of life. You got an insurance company, you bought this product called insurance, and now they're out there to frankly ream you. Insurance adjusters get bonuses for cutting you off from care early, from giving you a little check instead of a big check to help pay for lifetime care if you need that. Okay, they get bonused on that. They make billions a year, the insurance industry does, by not paying out what you need covered. So the only way you get paid for what you need is if you objectify it. And that's why we brought this equipment into the office and we send out for medical opinions on the lack of proper movement. You need that on your team. You see, auto accident companies, they've got all kinds of paid experts to work against you so that you don't get the care you need, you don't get the compensation you need to cover yourself if you do get injured. And not everybody gets injured in a car accident the same way.
Yeah.
You get 4 people in a car crash, and we've all heard of the drunk that hit a family of 5, and a whole family of 5 dies, and the drunk lives. All right, well, if you got 4 people in a car, 4 people are all going to get different injuries from that same accident, or lack of injuries from that same accident,
Sure.
depending on how they were positioned, whether they saw it coming, were they bracing already for the accident, were they seatbelted properly, were they wearing the belt properly, did they have the head restraint on properly. All that plays a part in it. The human factors play more of a part than the car factor. In other words, the car crushes the same in the accident, but the individual humans will be injured differently, depending on their positions. And if you don't know how to ask the right questions, you'll never get those differences out.
Each one had a different angle, huh?
Yeah, exactly.
Yeah.
Was one person's head turned to the right looking at the baby next to
Sure.
them,
Sure.
and the other one looking straight ahead, and the other one to the left saw the car crash coming and braced themselves? Was one person physically strong and fit, let's say a high school football player, a star athlete,
Okay.
and the other one his grandpa that's been through 6 other car crashes, or like a patient told me the other day, 12 car crashes in 2 years. Okay, that's a different person. Okay, you've got an uninjured person, a perfect physical specimen, in the same car, sitting next to somebody who's had multiple traumas. Well, obviously, the person with multiple traumas, with more scar tissue, more injury, brittler, if that's a word, is going to be injured more.
Now.
Yeah, they're going to be injured more.
Yep.
Okay, so my job is to help explain that to the insurance company, objectify it, so they understand why person A needs more care than person B, if they need it.
It's not one size fits all.
No, not at all. When you walk into our clinic, it's going to be an exam that will tell us exactly what we need to do to treat you and why that's different than anybody else in the accident or on the planet. You're all different. As you have different fingerprints, you've all led different lives that make you more susceptible or less susceptible to injury. So in that group of 4 in a car accident, one person may not need any care, one may need a short run of care, and one may need a longer run of care, and one, because of debilitating injuries, permanent injuries that need to be objectified and documented, a lifetime of care. Which one were you? Which one were you? It's up to my job to figure that out.
Sure.
So
There's a lot as far, and we talk about this on several occasions, the education you put yourself through.
yeah.
You are always looking for another answer.
You know, it's kind of funny. People say, well, Doc, what movies have you seen lately? What have you done? I don't see as many movies as I used to because I belong to a number of subscriptions, professional subscriptions that allow me to watch educational videos on CRMA, on Surface EMG, okay, that explain the latest, greatest coming out as far as documenting ligament injury, rehabbing it. Hey, it's first you got to find it, know what you're looking for, and then you got to rehab it properly to give that person the best chance. So oftentimes, if you were to somehow find my websites visited at night, it is a whole lot of continuing education, cool videos, helping me stay abreast of the absolute cutting edge of what we need to give you the best opportunity to recover. And you know, not everybody needs a lawyer with something like this, but the complexity is working through an auto accident, whether it's Michigan no fault or Wisconsin fault, you may need a lawyer, and we may have to steer you there. But what's cool is if you don't have a lawyer, you can still get care at my office. If you don't have insurance, you can still get care at my office, oftentimes for no out-of-pocket to yourself.
Yeah.
Okay?
True.
And certainly our initial visit is no out-of-pocket to yourself. You know, it's always it is out of pocket. It's a whole $20. All right, so you can come in and get a thorough workup, and we can tell you what you need to do. An honest, objective, really basis for what have you got for a problem, and can we help you? I can't help everybody. I can't help everybody, but that's why we have orthopedic surgeons, neurologists, neurosurgeons that we refer to, that we can send you to the right place.
You do put your patients first, don't you?
Well, yeah.
Before yourself.
Well, you've got to. You know, it's your reputation's on the line. If I can't help you,
Right.
you know, we're not going to accept you, first of all, if I can't help you. And if I can't help you, we're going to send you out to who I think you should be going to. But if you got ligament damage, the odds are you're in the right place when you come to my office. You may have other things going on that
Yes.
may require further workup.
Yeah.
Okay, that's just part of the game. You know, not every accident has ligament damage and that's it. Obviously, you can have broken bones, internal bleeding, other things that go on that need to be evaluated, testing that needs to be done outside the office.
Fractures seem to occur very easily in some instances.
More and more so, it seems like.
Yeah.
I mean, I've had a few lately in my office. One guy just fell and broke his clavicle in 4 places. You know, Dr. Vendetti was available to take care of that, so we sent him out. I have another friend of the practice patient that just fell and shattered her elbow, so she had to go in for surgery. All right, not every case is a case at my office that we can fix everything. Okay, but those cases certainly need care for the ligament damage that they have. But first, you got to fix the broken bones.
Dr. John Nowicki, Nowicki Chiropractic and Wellness on In Touch. For In Touch, I'm Aaron Harper.